Have you recently been to the doctor looking for answers about mysterious aches and pains, anxiety, or just generally feeling off? Well, the reality is that your health and well-being is actually up to you. My guest is Dr. Julia Bowlin, here to talk about personal awareness medicine. Julia, thanks for being here.
Thank you, Kristen. It's my pleasure.
Julia, what is personal awareness medicine?
Personal awareness medicine is exactly what it sounds like. It's becoming aware of the things that could be making you healthy or harmful. It's about becoming aware of the things that you should be doing to be healthy and things you shouldn't be doing. Things you should want to do and maybe don't want to do to be as healthy as you possibly could.
Now, you have your own thriving private practice where you see people on a regular basis. What are some of the things that you hear from your patients?
Oh, so many times the patients will come in and they just want a pill, Kristen. They have all these problems and they say, Dr. Bowlin, I just want a pill. And when I asked them, I said, you know, how bad do you really want to feel better? Do you really want to take charge and really feel as good as you can? And the answer is always yes. But when I tell them, do you know the answer is right there? I'm like, what do you mean? It's you. You need to become personally aware and responsible for what you're doing that may be causing your own problems.
You know, we're having a lot of changes inside the medical industry, and I know as a physician, you don't have as much time to spend with your patients. How is this impacting our ability to get better?
Well, the patient-physician relationship these days has a lot of stressors on it. Today, the patient gets less time. The doctor's more frazzled because now not only are we supposed to be fulfilling the computer requirements, but we're having less time to be able to communicate with our patients because we're stuck behind a keyboard wall, which I'm sure many people have already seen. And it's really frustrating as a physician because I want to spend more time with my patients. I want to dive into things that are more personally important to you that may be causing you pain and struggles. And I'm having a hard time doing that in my everyday practice.
And so that's why you created personal awareness medicine?
That's why I created the course, Prescription for a Healthier, Wealthier, and Wiser You. I was tired of not being able to give my patients what they really needed. What they needed was more time, more information, how to find out how to inflame their passion to be able to do what it is that they need to do to feel better, think better, feel clearly, and have more peace of mind.
You know, the reality is that some illnesses come on suddenly. Like we can get the flu, or we can have food poisoning, or we can have things that just come on suddenly. But other things develop over time and have a lot of factors that contribute to our health and wellness. How can we tell the difference in what we can, and make a decision about what we can do to get on that path to wellness again?
What I tell you right off the bat is almost every illness you get, you play some role in developing. The choices that you make of the things you put on your body, in your body, and around your body play a huge role on whether you can recover from that virus you picked up today, or whether you're having joint pain and inflammation, or whether you're sleeping poorly.
You are interesting as a medical doctor in that you also believe in spiritual practice and meditation. That's not something we see in mainstream medicine today, but how important do you believe that it is to also honor our spiritual self?
Well, when it comes to being spiritually empowered or physically empowered, the most important thing is to recognize is that the inner part of you plays a huge role in health and recovery. How you breathe, how you relax, how you listen to your intuition. If you can tap into that very important part of becoming spiritually empowered, that's one step in your overall health. You need to look at your physical health. You need to look at your mental health, how you think and how you feel emotions, but you also need to look at the spiritual health and how you think internally and connect with your own spirit.
And I know that you have developed virtual education for people who just need more information about how to really make that shift into being in charge of their own life.
I did. The course is online at my website, juliabowlin.com. And if you go into that website, you're going to find ways that you can tap into my personal awareness medicine. There's a toolbox that you'll be able to download certain types of tools and snapshots and ways that you can monitor and evaluate and assess how well you are and are not doing as far as taking care of yourself.
If you want to feel better today, what's the first step?
The first step, you need to decide to do it. You need to decide that it's time for you to be a priority. It's time for you to gather your resources and take what it takes and do what it takes to get healthier, wealthier, and wiser.
Dr. Julia Bowlin, thank you for being here on Let's Start a Ripple.
Thank you.